Hello friends, this is DrRBKushwaha, Professor at VCC Scotch Jammu, Araspura. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and hit the bell icon for the further notification. So today we have a case of mast cell tumor at the lateral aspect of the humerus, and this is scapula, and this is a 6.5 years old male Shih Tzu dog. So you could see here, so this tumor is subcutaneously, but it is not as free as the other tumor, and this is the mast cell tumor. So in the mast cell tumor we know the recurrence rate is very high, and if you see here, so the location of tumor is very awkward. So in this case we have to make an incision in such a way so that there won't be any deformity, or you can say any undue contraction over this side. So first we make the, you can say, mark the, you can say, incision area. Like this. So we start from the here. So this is the So this is our proposed site of incision, and we have already measured that. If you unite like this, so it will definitely come closer, there is no problem. We mark this area. Now we start giving incision here. Making an incision over the loose skin is very difficult. Without reinforcing. Now we deepen the incision. So we have made the incision all around this tumor. So now next step to just undermine bluntly, subcutaneously. So here this is the scapula. Hold it. Hold like this. Hold. So you could see this blood vessel, so we ligate the blood vessel, but before ligation cut it. Wait, let me ligate the another side also. So tumor removal is not a big task, only the in such type of tumor how you make the incision and how you repair, that is the challenging. So now we cut in between here. So here now you could see, so very carefully we dissect here. This is also involving the underlying muscles. Shall hold like this, okay. This one is the bone. So we have to sacrifice this cephalic vein as well. This is the deltoideus process of this humerus here, and this all involve the muscle also. It is not only the subcutaneous. And if you see here, so this one is Sahib. So in the meantime, load the 2 ml lignocaine hydrochloride solution. Lignocaine. Since here the muscles is almost, I am cutting the muscle also here, so we have to infiltrate the lignocaine solution. what was the finding of X-ray, Musab? Is there
soft tissue
any
means-
is there any involvement of the bone also?
So उसमें receive नहीं है soft tissue opacity दिख रही थी इसमें attached था सर इधर था सर bone के साथ जाता था
It's very very difficult tumor. It is not it attached with the underlying muscle. So now you could see this is all lateral muscles of this humerus region involved. You could see here. So the superficially had the radial. This is the radial nerve. The which one? This other branch. This is the deep branch. This is superficial branch which we have cut here. So this one deltoideus process, and this is deltoideus muscles, and here the cleidocephalicus muscles we have inside. This one is brachialis. This one is the lateral head of triceps, and this one is the long head of triceps. So we have to sacrifice this one also. This is not so easy, and in this case chances of recurrence is very very high. So first I remove superficially here, means try to prevent as much as possible, and then after that I will cut the muscles, the affected muscle. So now we have removed this tumor, and if you see, so this one is the proximal part of the radius ulna. So this one is the olecranon process, and this one is the humerus, and this one is the scapular spine of the scapula. So you could see here, so the muscles here, the supraspinatus and other. So we cut also this here. So in between we have resect the muscle partially also, because the tumor was attached very much with this tumor. So now the next step is to repair of this incision. So this is a very tricky one, and whatever the few part of the, you can say, tumor which is left, so I have excised also carefully. So now I start to giving the suture from the hair. So since here this is almost a subcuticular pattern here, So after this I will also go for the subcuticular pattern up to here, because in this region no muscles was involved, but here if you see, so first I just bring the skin edges close together and then I further apply the, now you see. So one of the student is working on this tumor, so he planned this surgery, but right now I am feeling that definitely this is not a right. This animal has to go for the amputation of this limb in 1 or 2 months. Now here I am just suturing the fascia part, superficial muscles. This is the only one suture, na?
Yes, sir.
Musa,
Yes, sir.
ask to owner to bring 20. So now you could see here, so there is slight dog ear formation here. So you will also So now next step is we go for the subcuticular suture and then finally we apply the skin. So now you could see here, so this subcuticular suture pattern is going on. So overall excision was good, but I am still worried about the recurrence, since this is the mast cell tumor and also involve the underlying muscles. So we have just informed to the owner that whenever the next time the tumor will recur, so instead of excision of the tumor we go for the amputation of the limb. this one is the 20 polygalactic 910, and the previous one which apply for closure of the muscles, the first layer, so that was basically number 1 polygalactic. So here there is a disparity in the length of the skin here, so we have to manage by taking the bigger bite here, means engaging the larger area and here engaging the smaller area. A bit here. So to certain extent we can manage this disparity. Although there is no need here, but we can finish further apply the cuticular here also. This is the round body, na? So now the next step is only the application of the simple interrupted suture just to close this skin further. So Dr. Achal will do this skin suture, and after that then I will show you the final appearance of this operation, and in the meantime I am going to operate the other surgery. So thank you very much for watching this video, and if you like the surgery then you subscribe the channel and hit the bell icon for further notification. And if you want to become the member of my channel, so kindly hit the join button and become the member. Thank you very much.